Today's topic is about natural remedies that can be used to treat polycystic ovarian syndrome, also known as PCOS. If you want to know about PCOS, the symptoms, what causes it, you can get it, and natural remedies that you can use to treat it and keep it under control. Even if you've been finding it difficult to conceive because of PCOS, this video is for you. So if this sounds like something that interests you, I advise you to please kindly watch this video to the end. Hello guys, and welcome to my YouTube channel. Pharmacist Okafor Ngozi is my name. As always, I am very excited to be in your midst once again. Today's topic is natural remedies that you can use to treat polycystic ovarian syndrome, also known as PCOS. A lot of times, people don't even know what polycystic ovarian syndrome is. People may be having the symptoms, but they don't know what it is. Some women are going through the symptoms, but they don't know that it is polycystic ovarian syndrome that are going through. In fact, most time people get to discover about this ailment only when they are finding it difficult to conceive or when they start adding excessive weight. So this video is going to enlighten you more about PCOS, causes, how it manifests, what you can do to put it under control, and natural remedies that you can use to treat it. And even if you've been experiencing infertility because of this PCOS, this video is going to enlighten you on how you can still get pregnant and carry your baby even though you've been diagnosed with polycystic ovarian syndrome, also known as PCOS. But before we go further into this topic, I want to, as always, appreciate my wonderful subscribers. Thank you guys. I am very grateful. I love you guys and I appreciate you guys. And if you are just bumping into this video, Okafor Ngozi is my name, and this YouTube channel is where I discuss about health issues, healthy lifestyle choices, women health, child health, and so much more. As long as it's something that will keep you healthy and make you happy, this is what I talk about. But for some times I've been talking about things that relate to fertility. I promise you there's none of my videos that are going to open to watch that are going to learn a lot. There's something that will add to your knowledge about health or health related issues. Therefore, I'm encouraging you to please kindly subscribe to this YouTube channel so that you can be among the first to be notified whenever I drop any videos. Thank you. Now guys, let's go straight to the topic. So guys, polycystic ovarian syndrome is an endocrine disease that affects women of childbearing age from 15 to 44 years. And there is no pinpoint cause, or you can say this is a particular thing that leads to polycystic ovarian syndrome. This is because there's a lot of causes of polycystic ovarian syndrome. Number one is genetics, okay? It is inheritable. So if you're a woman and your mom had polycystic ovarian syndrome, you have 50% chances of having polycystic ovarian syndrome. The issue is that most times women don't even know that they have polycystic ovarian syndrome, except when they go for medical check, or maybe because they find it difficult to conceive, or maybe because they're adding excessive weight, or maybe because of irregularities in their period. They want to find out why, and that's when they discover that they have polycystic ovarian syndrome. But the issue is, if you trace this, it's possible that your mom have had polycystic ovarian syndrome or had issues with conceiving that is related to polycystic ovarian syndrome. Therefore, genetics is one of the causes of polycystic ovarian syndrome. Another cause is poor lifestyle choices, okay, which has to do with maybe diet and general everyday lifestyle choices that we make. Another is insulin resistance and glucose intolerance. So these are major causes or things that can lead to polycystic ovarian syndrome. Let's talk about how this polycystic ovarian syndrome manifests. Polycystic ovarian syndrome is an ovary that is filled with cysts with immature eggs. So when you look at the normal ovary and ovary that has PCOS, you find that the ovary that has PCOS has a lot of cysts, okay, a lot of immature follicles filled with eggs that are not matured and that will not mature. In fact, PCOS is also known as ovulatory disease, because the major thing is that the woman does not get to ovulate, and this is also one of the reasons why they have irregularities in period. That is, they don't get to see their periods every month, and this is accompanied with hormonal abnormalities and irregularities in ovulation and menstruation. Like I said earlier, they don't get to menstruate every month. You find out that some women that are going through this ovulate maybe once in 3 months, once in 6 months, depending on the severity of their cases. Generally, it's a metabolic disease that is associated with insulin resistance and glucose intolerance, like I said earlier. Let's look at the symptoms of polycystic ovarian syndrome. Okay, there are 3 major symptoms of polycystic ovarian syndrome that once someone has 2 out of these 3 or the 3, the person is diagnosed with PCOS, polycystic ovarian syndrome. Number 1 on the list is irregular periods or absence of period, that is amenorrhea, which is there is no period at all. Number 2 is excess androgen in the body. Okay, the person have excess of male hormones, that's the androgen or testosterone. The person has excess of it. And number 3 is polycystic ovaries, that is ovaries filled with cysts. So if someone has 2 of these three major symptoms, the person is diagnosed with polycystic ovarian syndrome. Other symptoms, guys, are failure to ovulate. I've mentioned this earlier. The person doesn't ovulate monthly. Acne due to excessive male hormone. Hirsutism, that is excess hair growth. Find that the person has hairs on the chin, on the chest, at the back, on the belly, just like the males. Another is alopecia or male pattern baldness. So have this baldness just like you see in males. These are baldness that is due to excess testosterone production. It's also seen in males. Another symptom is excessive bleeding during period. So the person doesn't get to see her period always, but when it comes, it comes with too much heaviness. So these are the symptoms that manifest in women with PCOS or polycystic ovarian syndrome. I also like to add that the severity determines the amount of symptoms I won't see. For those that their own is very severe, all the symptoms will manifest. But if it's not that severe, of course, the symptoms will be mild. So the person is not going to see all these symptoms that I've mentioned here. It's also very important, guys, that I bring to your notice that anyone going through PCOS will find it very difficult to conceive. The reason is because the person cannot ovulate. Okay, and if someone can't ovulate, it is very, very difficult for the person to conceive. Now, what could be the reason why PCOS leads to infertility? Let's look at that. So in people who have PCOS, there's excessive amounts of androgen and insufficient amount of estrogen and progesterone. Now, this is because there is not enough follicle stimulating hormone that will convert the androgen to estrogen or female sex hormone. Because of this inability of the follicle stimulating hormone to convert the androgen to estrogen, the follicle cannot mature and ovulate. So this leads to infertility because there is no ovulation. But hey guys, all hope is not lost. This is because there are still natural ways that this PCOS can still be controlled and managed using lifestyle modification and choices. Let's look at them. So guys, one of the things that we can do is balancing the insulin. Insulin resistance is as a result of cells not responding to insulin when it comes with a new batch of glucose. And this is because there is saturation of insulin at the receptor size of the cell. And this is due to diet rich in refined and simple carbohydrates. The resultant effect of this is excessive glucose in the bloodstream and not enough glucose in the cells. Consequently, this results in fatigue, lethargy, and even increased risk of infection because of too much glucose outside the cell, and also it can lead to diabetes. Research has also found that insulin resistance is implicated in excessive production of androgen, which leads to anovulation. Another important factor is addressing testosterone, ovulation, and menstruation. Also, another important factor that to be considered when trying to treat PCOS. Guys, let's look at natural remedies for PCOS. Number one is avoiding foods and drinks that can make the PCOS worse. Example: coffee, alcohol, biscuits, soft drinks, sugar and juices containing sugar, refined carbs like bread, chocolates, lollies, and so on. Number two is eating small protein-rich foods. It's important to eat small protein-rich meals like every 3 hours. This will help in balancing the blood sugar. Number three is exercising regularly and maintaining a healthy weight. This is very, very important because 80% of women that have PCOS are obese or overweight. So it's very, very important that you engage in exercise. You do more of cardio and weightlifting exercise in order to build more muscle, because the more muscle you build, the more fat you burn. Number four, guys, is adding cinnamon to your cooking. Cinnamon is very, very important in controlling blood sugar. So if you want to improve insulin sensitivity to glucose, you have to be adding cinnamon. You can make cinnamon tea. When you're making healthy snacks, you can add cinnamon, you can put it in your fruit juices. It helps to increase sensitivity of insulin to glucose. Number five on the list is minimizing your intake of dairy products, which include milk, egg. This is because they have hormones, pesticides, herbicides. Even if these dairy products are natural, these animals also make their own hormones, which can also disrupt your own hormones. So it's very important to minimize their intake to the barest minimum. Number six, guys, is taking licorice. Licorice can be taken as a tea, okay, and it can be gotten from health stores. It helps in balancing the hormones. Number seven, guys, is adding more of these superfoods to your meal. Eggplant, cayenne pepper, ginger, garlic, nutmeg, turmeric, rosemary, leeks, basil, chives. These are superfoods that can help to control the symptoms of PCOS. Number eight, guys, is stress reduction. It's very important that you control your stress level, and this you can achieve through yoga, meditation, sleeping at least for 8 hours, breathing exercises, taking lavender, lemon, or chamomile tea. Okay, this helps you to relax and de-stress. Number 9, guys, is taking a good quality multivitamin and fish oil. Good multivitamins can help in improving egg quality and addressing the issues of ovulation. And also, omega-3 fish oil is very good in controlling inflammation. And these are going to help to improve the health of the ovary, making it to produce healthy eggs. So finally, guys, herbal teas are very good for controlling symptoms of PCOS. Cinnamon helps to increase sensitivity to insulin, therefore balancing blood sugar. Licorice is very good for treating hormonal imbalance. Cayenne pepper helps to stimulate metabolism and also help in fat burning. Turmeric and ginger helps to reduce inflammation, and ginger can also increase circulation. One can combine these herbs and take them with non-dairy milk like coconut milk or oat milk with hot water, especially those that are having severe symptoms of PCOS. You can give it a try. So guys, with this we have come to the end of today's topic on natural remedies for PCOS. Thank you very much, guys, for watching. You may also want to watch some of my videos that I've done on ways you can improve egg quality even if you are over 35, and also foods that can improve fertility. Thank you very much for watching. Please always remember to like, subscribe, and share so that this video can reach more people. Thank you and bye.